Why do you think it's been in calendars for so long?
Well, I mean, I think there are a few who don't necessarily want to see us expending the monies on these children for continuous eligibility enrollment, and their opposition is blocking the bill from coming to the floor of the Texas House. But look, allow the members to have their say. I've talked to the members, and I know that a strong majority of the members, when given an opportunity to vote on House Bill 1541, will vote for it. And it will be more than just Democrats voting for it.
Did I hear you right in your press conference there say that it'll be a one-time to make use of the stimulus money, and then next term it wouldn't be there? Would that not be unfair for the children?
Well, I put it this way. You do as much as you can with what you have while you have it. One of the reasons why we're able to do it this time is because of the federal stimulus dollars. What I have said to my colleagues and to the leadership in the Texas House is that I will sunset this provision. I will say that because of the federal stimulus dollars, let's do it for the 2 years. And then we will sunset it, which means the only way that it can continue is that we have to come back and affirmatively do it. And I will say to the members of the House 2 years from now, if I'm here, that the reasons why we may not be able to do it is because the money is not there. But while the money is available, do we say no to the kids? Do we not provide 258,000 kids for 2 years the health care coverage that they desperately need? Or do we just say, well, 2 years from now the money may not be there, so we're not going to even take care of what we can right now? To me, that's a non sequitur. It doesn't make any sense. It's not good government, and certainly we're not taking care of our children.
I know you represent Houston, but I would imagine this would be absolutely enormous for the border region which we cover. Can you give us a comment on what it could do for the valley?
It will be huge. Bear in mind that we are talking about the poorest of our children, who don't have health care coverage or who are getting it on a delayed basis. From the valley, along the border, West Texas, East Texas, and urban Texas, these are kids who need health care. They need to be in school, learning, not in pain, not in sick, not at home, and not in an emergency room, unable to afford the coverage, and everybody else's bills are going up. I cannot think of an issue that is more worthy of our time and attention and our advocacy than to provide the health care coverage to our children. I just can't think of any. And if there was any issue that we ought to be standing firmly on, it should be providing health care coverage and utilizing the federal stimulus dollars to pay for it while we have the money in our hands.
One last question. You must be very encouraged by the support you've got here today from the business community.
I am very encouraged. I think they recognize, look, if we don't do the right thing, who's going to pay for it? The people who have health care insurance, private health care insurance, their premiums are going to go up. Homeowners, their taxes are going to go up. Emergency rooms are going to be crowded. It's going to cost more. Ultimately, there is a cost associated with uninsured people getting sick and requiring health care. Ultimately, all of us will pay for it. The business community will pay for it, and homeowners will pay for it as well. We may as well do the right thing while we can, and let's do it on behalf of our children.